Hi, good day. I am Shineda Velacruz and I will be your student nurse for today. I am going to perform administering enteral feeding via nasogastric tube. First, check the physician's order for the type, amount, and time of feeding. This is to avoid errors and will give the assurance of the type, amount, and time of feeding are correct. Next, I will going to wash my hands to avoid any contamination and to clean and remove the microorganism in your hands. Next, assemble the equipment. We need to have a prescribed feeding solution, 10 to 20 ml for infant and 5 to 10 ml for neonate. Next, glass with calibration, 10 to 20 ml of water, small towel, stethoscope, neonatal feeding tube, and tape. This is to prepare for the upcoming procedure of the patient. Next is identify the patient. Hey baby of Mrs. Cruz. Identifying the patient is to avoid errors of the procedure. Next, bring the equipment to the bedside and explain the procedure to the client. This is to easily reach the equipment needed and explain the procedure to the client to be comfortable and be aware of the procedure. Inspect and palpate the patient's abdomen for distensions. Place the patient to the high Fowler position. High Fowler position is assist clients to do the procedure easily and correctly. Now, spread the small towel across the client's chest. This is to make the procedure more comfortable and easily done. Next, attach the syringe at the tip of the NGT. This is a 5 ml syringe. Attach it at the tip of the NGT. Next, check the placement of the nasogastric tube using the two techniques. Aspiration of gastric contents through stomach through the syringe using gravity. For auscultation, inject 1 to 5 ml for infant, and for neonate is 1 to 2 ml of air while listening to your stethoscope position at the epigastric area. Listen for the whooshing or gurgling sounds. This is to make sure that the tube is insertly corrected at the stomach. Initiate intermittent feeding. Pinch proximal end of the feeding tube. Next, fill the syringe with formula and keep the bottom of the syringe no higher than 6 inches above the child's stomach. Place the tubing and allow the formula flow in gravity. Because gravity promotes movement of the feeding in the stomach. After administering the prescribed amount of formula, flushing tubing with at least 5 to 20 ml of water, depending on the viscosity of the feed of medication. Next, after the feeding is complete, cover end of the feeding tube with a plug or clamp. This is to avoid any contamination directly in the stomach. Now, birth the child and have the child head raised for about 30 minutes after the feeding is done. This is to elevate position, prevents the child from aspiration or feeding solution into the lungs. Next, rinse the equipment with warm water and dry. To disinfect the equipment to avoid contamination and transmission of microorganisms. Next, after the feeding of the client, we need to record and document the procedure and included the type and amount of the feeding given, time it was given, amount of additional water given, patient's tolerance of the procedure. It is important to record patient's data because these are essential for continuity of care of your patient. Lastly, monitor breath sounds, vowel sounds, gastric distensions, diarrhea, constipation, intake and output, daily weight, and serum chemistry result. To determine the placement and patency of NGT and monitor any unusualities or abnormalities on patient nutritional health.